Hi again, this is Dr. Heather Austin Robillard, and this is the part 2 of the Process and Behavioral Addictions lecture. In this lecture video, I'm going to give you a brief overview of the different types of behavioral addictions. By now, you should have already had a lot of review in your other classes about different types of behavioral addictions, the characteristics, and all of that. In this lecture, I want to primarily focus about the diagnostic criteria, assessment, and treatment of these disorders. So, gambling disorder is one of the only process addictions that is currently recognized by the American Psychiatric Association in the DSM-5 as an addictive disorder. This change occurred in the most recent edition of the DSM, which is DSM-5. That is because the other two behavioral addictions, which are eating disorders and the non-suicidal self-injury, are actually considered compulsive disorders in the DSM. So gambling addiction is the only one that's considered an actual behavioral addictive disorder. Let's look at some of the definitions of gambling. One is the problem gambler. This is a person whose gambling behavior has caused problems in any one area of their life. Problem gambling occurs in around 3.5 to 5% of the population, and disordered gambling, which borders problematic gambling, but not yet an addiction, occurs in about 5 to 9% of the population. It is important to recognize that gambling is a very normalized activity in our society and is seen actually as a recreation or a hobby and something to be enjoyed. It is part of people's vacation to areas that have legal casinos and is also online. As professionals in this field, we should have some concern that as the opportunities for gambling become more accessible and increase, rates of problematic gambling will also increase. Pathological gambling is a person whose behavior causes problems in several areas of their life and becomes obsessive persistence in behavior despite the negative consequences that are occurring. An individual who has gambling addiction will have the progressive illness, and there is a difference between problem and pathological gambling due to two things. One is time, and two is money. A problem gambler may spend $3,000 a year on average in gambling, whereas a person who has a pathological attention to gambling will spend over $11,000 on average a year. There are also recreational or social gamblers who engage in gambling activities for hobbies but no current issues with their behaviors, and these individuals make up the majority of people who gamble. Individuals who are professional gamblers who engage in the behavior for the profession, and antisocial gamblers who have no conscience when it comes to their gambling. They might use gambling as a means to steal or create a sham, such as loaded dice or marked cards. There are also two subtypes of gambling. The first is action-seeking gamblers. These are individuals who are often male and are frenetic, excited, and always in action. The second is escape gambling or escape-seeking gamblers. These individuals are often drawn to the solidarity of gambling activities such as slot machines. They engage in gambling to escape difficult or unpleasant emotions or to escape from boredom. Okay, now that we've kind of covered what are the different types of gamblers, let's look at the clinical criteria or the DSM diagnosis criteria for gambling. For an individual to be diagnosed with a gambling addiction or disorder, the individual must have a persistent, recurrent pathological gambling behavior leading to clinically significant impairment or distress indicated by the following criteria. They need to exhibit at least 5 or more of the following criteria over a 12-month period to be considered a gambling addict. One of the criteria is a preoccupation, either reliving the past or planning future experiences that revolve around gambling. Another criteria is gambling with an increasing amounts of money. So it's kind of like that tolerance that they need to spend more money in order to get that feeling. A repeated unsuccessful attempt to control, cut back, or stop gambling. See how that might be similar to a chemical addiction. That's one of the criteria for chemical addictions, is a repeated unsuccessful attempt to cut back on their use. Relentless or irritability when attempting to cut back. Gambling to escape problems, attempting to recoup previous losses. So this idea that they keep trying to play in order to make up for the money that they've lost. Jeopardizing or losing jobs, relationships, education, and career opportunities. Relying on others to get bailed out of debts. And then lastly, craving. So they have a craving for gambling. Individuals who meet these criteria will be given severity ratings based on mild, moderate, and severe, depending on how many criteria they meet. That's also similar to the substance use disorders. As I mentioned earlier, gambling disorder is the first process addiction to be moved into a diagnostic category of addictive disorders. This change reflects that substance or chemical related addictions and process addictions are characterized by many of the same symptoms. They share many of the same etiological factors, and the brain mechanisms that are associated with them appear to be very similar. To help prepare you, let's look at some of the statistics specifically for gambling disorder. 125 million people gamble or engage in gambling activities. Men are more likely to be gamblers than women, and women in the U.S. represent a little over 1/3 of those diagnosed with gambling disorders. Men are more likely to be gamblers and be those that engage in action-seeking gambling. Women tend to play slot machines and be escape-seeking gamblers. Women who do develop gambling disorders start playing later in life, but have a much more rapid development of their addictive play. So they have a faster progression in towards addictive gambling. Older people are more susceptible to gambling due to the accessibility. Additionally, it is important to recognize that there are high comorbidity rates with other mental health disorders. So 73% of gambling addicts also struggle with alcohol problems. 60% also have a personality disorder. Another 60% also have a nicotine addiction. 50% struggle with some kind of mood disorder like depression or anxiety, and 38% of them have drug use problems as well. Another important area to be aware of when working with individuals with a gambling disorder are the phases of gambling. Now, I know you've learned about this in previous classes, so I'm just going to try to briefly summarize it. There's the winning, losing, and desperation phases. Winning phases is that initial gambler is using it for recreational, pleasurable experiences, especially those who use escape gambling. The amount of money spent on gambling activities tends to be smaller in this phase. In this phase, even just breaking even is enjoyable and kind of gives them that euphoric feeling. They also stay in action or continue to be able to play. Winning is really secondary. It is also all about avoiding or escaping their realities. Early on, a big win might have fueled the crave to gamble, and it really is not so much about the amount of money that was won, but just the win itself. The first rush of winning is comparable to taking that first hit of cocaine. Finally, in this phase, the wins are easily remembered and loses quickly forgotten. In the losing phase, this is where tolerance builds, and the gambler needs to make bigger bets or take larger risks in order to get that same initial rush. This is where they might be familiar with the term chasing their losses. They are trying to earn back the lost money and deal with the debt, leading to poor decisions. The individual will often be in denial about the extent of their problem, lie in order to stay in action, and make very poor decisions. The chasing they engage in can bring about depression, deception, isolation, and irritability. In order to manage these difficult feelings and emotions, the gambler relies on gambling in order to escape them. So it kind of just is that cycle, similar to what we've seen in the process model of addiction. In the desperation phase, the need to play causes the individual to really be stuck in the action seeking. Patience and common sense just go out the window, and the individual's poor decisions can lead to very negative consequences, such as a loss of job, destroyed relationships, financial debt. Instead of understanding that these behaviors are leading to negative consequences, they see their failures in the game as the problem and of them just being unlucky. Then there's another phase that you might not have heard of, which is the giving up phase. In this final phase, the gambler stops believing that they will win but continues to play in order to just escape their concerns. If a win does occur, they may feel manic for the win, but each loss brings about further depression, panic attacks, insomnia, and health problems. For those who identify as hitting rock bottom in their playing, almost three-fourths of those in a study done reported that clinical levels of depression and close to one-fourth attempted suicide. It is important to be aware that depression and suicide ideation working with gamblers who have hit a very low point. These phases can be used to assess where your client is currently at their level of addiction and what ways you can challenge your client's thought process. Some other additional points that can help professionals who work with individuals with a gambling disorder are that it's important to understand that gamblers want the rush from the win or the peace of mind from zoning out more than they actually want that money. Gamblers often suffer from what we call the magical thinking. Their thoughts equate with doing, if I think it, it will happen. And they ignore the laws of chance. There are specific probabilities to these games they play, and they often are ignored in the hopes and the chance of wins. Gambler's fallacy is a term used to identify the faulty thinking of an individual that they can control these random events. For example, an individual may think that based on the fact that the slot machine they are playing has not given off a winner in 24 hours, that they are the ones that are going to win if they play it. The odds of winning always stay the same, but gambler's fallacy is distorted, thinking that, and that kind of thinking supports their gambling. Finally, gamblers also experience withdrawal symptoms. Studies have found that they even experience symptoms very similar to alcohol withdrawal. They might report feeling restless and irritable, anger, even abdominal pains, headaches, diarrhea, cold sweats, insomnia, tremors, all of the above, intense desire to return to gambling. So what do we do? Here are some of the treatment modalities that have been found to be effective with gambling disorder. And actually, a lot of them are very similar to substance use disorder treatments. So one is motivational interviewing, getting them to a place in their process where they have a desire to change, challenging their faulty thinking, all of those things in order to get them to the place where they're actually making action towards changing their gambling disorder. The only evidence-based program that has been found for gambling addiction is cognitive behavioral therapy, or CBT. And by evidence-based program, this just means that there's been multiple studies done to show that CBT does have a significant impact on gambling use disorder. So it's not that the other treatment modalities may not be effective, but it just may mean that they haven't had enough research done to show that there is an impact. Currently, there's no specific medications, but there are appropriate medications for the symptoms of gambling disorder, like depression or co-occurring disorders that they had before gambling disorders that they're using gambling in order to escape from. So it's important to have their appropriate medications. Other things that might be important to consider when treating gambling addiction is that families are impacted very similarly to the substance use disorder family. So there's betrayal, there's lying, there's financial ruin, there's relationship ruin. So family therapy might be a very important thing to consider when working with a gambling addict. There are also a few residential treatment centers that work specifically with gambling disorders, where you can actually go into a residential treatment center in order to get therapy, group therapy, counseling, and all of those things in order to help you maintain sobriety from gambling. And then there's also relapse prevention. So there's certain things that we want to help them deal with and help them be aware of in order to prevent them from relapsing back to their gambling disorder. So this next one is going to be compulsive shopping and buying, or also another one that's similar to this is hoarding. Because compulsive shopping or buying is described as a pattern of chronic, repetitive purchasing that becomes difficult to stop and ultimately results in harmful consequences. So one thing that I want to point out is that there are actually pretty similar rates of compulsive shopping and buying between men and women. There's not even a significant difference in the rates that men struggle with compulsive disorder compared to women. However, there are typically different items that women buy versus men. Depression is a major motivating factor in the development of addiction. Again, similar to gambling, the high experience during these shopping adventures for an individual is very similar to the use of cocaine. An individual with a shopping addiction will frequently purchase items on impulse, not because they actually need this item or they have a purpose for the purchase, but they are doing so on impulse. When an individual makes this purchase, there is a sense of them actually being themselves. Warning signs for shopping or compulsive buying include spending money when the individual has already experienced negative emotions, fighting with a spouse or partner, feeling lost without a credit card, buying items on credit instead of cash, feeling a rush after shopping, feeling guilty due to the money they've spent, lying to others about money, and also thinking excessively about spending money. Hoarding is also an offshoot of compulsive buying. This is characterized by the excessive acquisition and inability to discard large quantities of objects that ultimately cover the living areas of one's home. To meet diagnostic criteria, a person must have collected and kept lots of items, even things that appear to be useless or junk. The items must clutter living spaces and keep a person from using rooms the way they are intended, and the items must also cause distress. Individuals diagnosed with compulsive hoarding tend to be in their 50s, although the disorder can start as early as teenage years. Rates of hoarding tend to be 1 in 50, and the individual is likely to have family members with this disorder as well. Simply cleaning up the hoarder's house and freeing it of junk is not actually a treatment like you've seen on those TV shows. The individual will need treatment to manage their anxiety and depression that comes with removing or getting rid of the items. The assessment and treatment of compulsive buying and hoarding, there is diagnosable criteria for hoarding, but there's not one, and again, that falls into a compulsive impulse disorder, but there's not one for the compulsive buying as an addictive disorder. Criteria, though, that we found is that there's an urge to buy, it feels uncontrollable, and this behavior continues despite all the negative consequences. There are similar treatments to substance use disorders, including CBT, dialectical behavioral therapy, and group therapy like Shopping's Anonymous and all of that. And of course, they also have a very high co-occurring disorder with other mental health disorders, specifically depression. You can see in this table 1 the diagnostic criteria for compulsive buying. There is a maladaptive preoccupation with buying or shopping. It is indicated by at least one of the following: frequent preoccupation with buying or impulses to buy that is experienced as irresistible or intrusive or senseless, frequent buying or more than can be afforded, or frequently buying items that are not needed, or shopping for longer periods of time than intended. See how that can follow into an addictive, similar to the chemical addiction. And then buying preoccupations, impulses, or behaviors are cause for marked distress. They are time-consuming, significantly interfere with social and occupational functioning. And the excessive buying or shopping behavior does not occur exclusively during periods of hypomania or mania. So this is not due to a mental health disorder, it's due to the addictive nature. Internet addiction is an impulsive need to use the internet for various reasons. An individual may be addicted to the interaction with online friends or online activities, researching topics online, or reading blogs. Some factors that might contribute to internet being so addicting is the ease and the anonymity of it. It allows people to form relationships online or behave in ways that they otherwise might avoid. Additionally, the internet is inexpensive, always available, instantly validating, rewarding, convenient. It's a great way to escape, and the output is under control of the user. It is very easy to get online and lose time. There are several different types of internet addiction. So there's cybersexual addiction, cyber relationship addiction, internet compulsion, information addiction, and computer game addiction. Internet addiction can lead to different consequences, such as issues with personal relationships, work issues, financial concerns. When an individual excessively uses the internet, they have to take time away from other life obligations. Attempting to reduce or quit time from online when addicted can result in withdrawal symptoms, including anger, depression, mood swings, anxiety, fear, irritability, sadness, loneliness, restlessness, and procrastination. Here is a reflection question to be thoughtful about as a possible future professional. When internet addiction moves into cyber sex addiction or pornography addiction, how do you distinguish between those two terms when providing a clinical diagnosis? And is online cyber sex addiction different from sexual addiction? What about internet infidelity? Would a person who has multiple online affairs be someone who cheats, or do they have an online addiction? There are important questions for the addiction and recovery field moving forward as internet continues to be a primary place in our society. Here are some of the warning signs. Internet addiction has a preoccupation with internet, use of internet at increasing amounts to achieve a certain satisfaction, repeated unsuccessful efforts to control, cut back, or stop using, feeling of relentlessness and moodiness, depression, and irritability when attempting to cut out the internet, online longer than originally intended, jeopardizes and risks loss of significant relationships, job, or educational opportunities because of the internet use, lies to family members, therapists, or others to conceal the actual extent of the involvement of their internet use, and the use of internet as a way to escape from problems or to relieve dysphoric moods like feeling hopelessness, guilt, anxiety. Again, treatment can be very similar to substance use disorders, but typically the use of cognitive behavioral therapy is what is used. And the main things that they like to focus on with cognitive behavioral therapy when it comes to addiction is 1, behavioral modification, 2, cognitive restructuring, and 3, a harm reduction approach. So maybe not eliminating internet altogether, but trying to reduce the harm of the internet use. Another thing that's important is they have found that antidepressants and anti-anxiety medications have been able to decrease internet addiction. And that some important things to think about are social skill groups and family therapy training about internet addiction to either prevent further internet addiction or to help the treatment of it. There's also some group therapies that are rising in order to combat some people's addictions to the internet. Okay, let's take a look at sex addiction, which could be talked about in an entire class, but we're going to talk about it briefly. So there is some debate about sexual addiction being, is it actually an addiction or is it just a convenient excuse for an individual's promiscuous behaviors or indiscretions? Sex addiction can be defined as engaging in persistent and escalating patterns of sexual behavior acted out despite increasing negative consequences to self or others. Sexual addiction can include excessive masturbation, viewing pornography, multiple affairs, phone sex, regular visits to strip clubs. It can also include illegal behaviors such as prostitution, sexual harassment, sexual abuse, exhibitionism, rape, and incest. Professionals should note that not all sex addicts go on to commit illegal behaviors. Many sex addicts do not progress beyond excessive masturbation or extensive use of pornography. Individuals who are child molesters are often sex addicts, though, with research estimating about 70% of individuals who commit child sexual abuse are sexual addicts. When assessing for sexual addiction, it is important to consider all factors related to sexuality. It's not enough to just diagnose based on frequency. The pursuit of pleasure to subdue pain or anxiety, lack of control over the behavior, continuation of the behavior despite negative consequences, and a continued obsession with doing, planning, or simply thinking about the behavior, all hallmarks for the diagnosis of sexual addiction. So information about the development of sexual disorders is whether it is to cope with depression, anxiety, stress, solitude, compulsive sexual behaviors, condition the body to release dopamine or pleasurable neurotransmitters. Tolerance also occurs whenever there's an excess of those neurotransmitters. Therefore, more time must be spent to gain a positive benefit. Sex becomes this all-encompassing activity. Part of the high comes from the risk involved with or following the pattern, and the other part comes from the actual sexual pleasurable release. Often it culminates in a sexual event, either legal or illegal, involving orgasm over which the addict has virtually no control. This is often followed by remorse and guilt and resolution to stop. Sex addicts often become depressed, suffer from low self-image, self-loathing, and despair over time, and money wasted in pursuit over their behavior of the trouble. So when we look at the statistics of it, many famous people have recently been highlighted in the media as being a sex addict, if you can think back to Russell Brand or Tiger Woods. But 70% of pornography site traffic occurs during working hours. And 10% of people who visit pornography sites are addicts and spend up to 8 hours a day online. Sexual addiction occurs in 3 to 6% of the population. 80% are men, with behaviors developing during adolescence and declining after the age of 40. While sex addiction, as I said, is not actually in the DSM diagnosis, Kafka in 2010 proposed for hypersexual disorder to be introduced into the DSM diagnosis, and it had a lot of support for the criteria of hypersexual disorder. Here's some of the criteria that he states would recognize somebody as having a hypersexual disorder. This is over a period of 6 months, and they have recurrent, intense sexual fantasies, urges, and behaviors in association with 4 or more of the following criteria: excessive time consumed with the sexual fantasies or urges, engaging in sexual fantasies or urges because of a response to a dysphoric mood, or repeatedly engaging in it because of stressful life events, repeated unsuccessful attempts to control or stop the sexual fantasies or urges, engaging in sexual behavior while disregarding risk for physical or emotional harm to self and others, significant personal distress or impairment associated with the frequency and intensity of the sexual behaviors, urges that are not due to direct psychological effects like drugs or co-occurring manic disorders, and the person has to at least be 18 years of age. Again, the treatment is similar to substance use disorders with motivational interviewing, cognitive behavioral therapy, just individual therapy in its own. There's also movement desensitization, which is EMDR, and it's specific for people. It's used very, very well for people who have trauma or PTSD, and then family therapy and group therapy. There are also specific 12-step group therapies like Sex Addiction Anonymous or Sex and Love Addiction Anonymous, and then certain medication. There's no medication specifically for sex addiction, but treatment for other co-occurring disorders that help with relapse. The final behavioral addiction that we'll talk about today is the food addiction. Research has demonstrated that some people get the same reward pleasure centers of their brain are triggered by addictive substances as they are activated by food. Highly palatable foods, rich in fat, sugar, and salty, play a huge role in this addiction. Like addictive substances, these highly palatable foods trigger the feel-good chemical in their brains, like dopamine. A pleasurable experience with food, the person quickly feels the need to eat again. Reward signals from highly palatable foods can override other signals of fullness or satisfaction, thus keep people eating even when they're not hungry. People who have signs of food addiction may also develop tolerance, so they need more and more food in order to get that pleasurable feeling. Some of the research states that food addiction is just as much as an addiction as a dependence to alcohol or drugs. Compulsion to take the substance, in this case food. They have difficulties in controlling their substance-taking behaviors in terms of termination or levels of use. There's a persistent use despite negative consequences or clear efforts that it's harming themselves. They experience withdrawal, and they experience a great deal of time spent in order to attain or recover or giving up other important activities due to the food. Now, I did not go over eating disorders specifically, but there is also research about like restricting behavior also giving you a high When you restrict that, they use that to escape pain. But you have a lot of people have been through or going through the eating disorder class, so I won't talk much about that. But another one coincides with food addiction is exercise addiction. Um, and this is just typically, when does something healthy like exercise become excessive and become addictive? Um, People who struggle with exercise addiction typically are motivated by both negative and positive reinforcements. When it is about control and when it impacts other parts of your life, like your health, is when it becomes addictive. Again, there's no DSM diagnosis for exercise addiction. However, it is assessed very similar to substance use disorders or eating disorders, in that there's a negative consequences. They continue to use it despite negative consequences, and there's an obsession, compulsive realm to it. And again, treatment is very similar to substance use disorders like CBT, but there's not a lot of other types of treatment like 12-step groups specifically for for exercise addiction.